Let me start by saying something many doctors won't say out loud. Masturbation in older age isn't just normal, it can be healthy, essential, and even life-changing. But sadly, most men over 60 don't get to hear this from a trusted voice. Instead, they carry shame, confusion, or worse, complete silence. And over time, that silence turns into avoidance. The habit fades, desire fades, and with it, a critical part of their well-being. You see, I've spent over 30 years as a urologist working with men well into their 60s, 70s, and even 80s. And there's one thing I've seen time and time again. When a man stops engaging with his own sexuality, completely shuts the door on solo touch, his body begins to respond accordingly. And not in a good way. Let me introduce you to Martin. Martin is 72, a retired professor, sharp mind, gentle soul. He came into my office not long ago with complaints he was a little embarrassed to admit. He said, "Doc, I feel disconnected, like I've shut off a part of myself. I haven't had a sexual thought in months, let alone an erection. And to be honest, I've stopped even trying." I asked him, "When was the last time you touched yourself?" He gave me that look older men sometimes give, half amused, half ashamed. It's been a few years now. And then he said something that stuck with me. I thought I was just past all that. That's where so many men get it wrong. They confuse slowing desire with the end of sexuality. But here's what most don't realize. Your sexual function is like a muscle. Use it or lose it. When a man stops masturbating altogether, it's not just his libido that fades. Here's what else happens. Blood flow to the pelvic region slows dramatically. Erections become less frequent, then less firm, and eventually disappear. Prostate fluid becomes stagnant, and a stagnant prostate can become inflamed, tender, and even increase the risk for issues down the road. Testosterone levels can drop due to reduced sexual signaling in the brain. Mood may suffer, because the brain loses one of its key pleasure and reward pathways. In Martin's case, all of this was happening quietly in the background. He wasn't ill, he wasn't depressed, he just felt flat. And this is more common than you think. Now I want to pause here and say this clearly, for every gentleman watching. There is nothing wrong with keeping an active solo routine, even into your 70s, 80s, and beyond. In fact, it can be one of the most powerful, natural tools you have for maintaining healthy blood flow, prostate function, hormone balance, emotional well-being, and yes, confidence and connection. That doesn't mean you have to do it every day. It doesn't mean it replaces intimacy with a partner. It simply means you stay in touch with your body. You remind your system that sexual function still matters. Because your body listens. If you stop sending those signals, it stops responding. Now, some men avoid masturbation out of guilt. Maybe they were raised to think it was wrong, selfish, or shameful, especially as they age. Others stop because they believe it's no longer necessary. And some just forget how much it used to help them sleep better, feel calmer, or even stay connected to their sense of manhood. But your body hasn't forgotten. And that's why I'm having this conversation today. If this message resonates with you, if you've been feeling a little disconnected, unsure, or even surprised to hear this from a doctor, do me a favor. Give this video a like, subscribe to the channel, and tap the bell icon. And down in the comments, just type, yes, if this is opening your eyes or giving you something to think about. Or type, no, if you're already on top of this, because every comment helps guide how I continue these conversations with you. Now, let's go back to Martin. When I explained that avoiding all sexual stimulation can actually cause your body to down-regulate sexual function, he was stunned. "You mean I've done this to myself?" he asked. I said, "Not intentionally. But yes, when we stop sending the signal, the system powers down. It's just like muscles. If you stop using your legs, they weaken. If you stop using your mind, memory fades. And if you stop activating sexual arousal, yes, even solo, then the mechanics that allow erections, pleasure, and release start to wither." That's not fearmongering. That's physiology. And here's the beautiful part. It can often be reversed. With just a little consistent solo stimulation, maybe once or twice a week, men like Martin can reignite their body's natural responses. Erections come back, sensation improves. And that flat emotional tone? It lifts. I asked Martin to begin gently reintroducing self-touch into his routine, not with pressure or expectations, but just with curiosity. I said, "You're not trying to perform. You're trying to reconnect." Within a few weeks, he emailed me, "Doc, I'm waking up with morning erections again. It's subtle, but they're there. And I feel like a man again." That right there is what this is all about. Your sexual identity doesn't end because you turn 60, 70, or even 90. It just changes form. And when you nurture it, on your own terms, it rewards you with better blood flow, clearer thinking, and a deeper connection to yourself. So no, you don't need to feel embarrassed if this is part of your life. You also don't need to feel broken if it's something you've lost and want to regain. Just remember this. Your body wants to work. You just have to give it permission. And one of the most natural ways to do that is through solo touch. In the next parts, I'll talk more about how to safely reintroduce masturbation if it's been a while, how it impacts prostate health, testosterone, and even sleep. I'll also share more stories from men like Martin who thought it was too late until they discovered it was simply time to reconnect. So until then, be gentle with yourself. Stay curious. And remember, you're still very much alive. And that is something worth celebrating. When Martin began his journey back to reconnecting with his body, it wasn't about performance or pressure. It was about healing something deeper, something most men don't realize they've lost until it's gone. You see, for decades, we've been told that sex is for the young. That past a certain age, the bedroom should be silent. That any desire, any touch, any attempt at pleasure past 60 is somehow strange, unnecessary, or even shameful. But let me tell you the truth from the medical side. As a urologist, I've seen that when men stop masturbating entirely as they age, there are very real consequences, not just physical, but emotional and psychological too. Let's talk first about circulation. Your penis is not just about intimacy. It's a vascular organ. That means it relies on healthy blood flow, just like your brain, your heart, and your muscles. When you stop getting regular erections, even just the natural ones during sleep or early morning, your body interprets that as a sign. We don't need this function anymore. So what happens? The smooth muscle tissue inside the penis begins to atrophy. Blood vessels lose elasticity, and the nerve signals that once easily triggered an erection begin to weaken. It becomes harder to respond, then harder to sustain. Eventually, for some men, it stops altogether. And here's the thing. This isn't always about disease or medications. Sometimes, it's simply disuse. I had a patient named Gerald, age 78, a retired fire captain. Strong, stoic, dependable. He hadn't touched himself in over 5 years. Wasn't worth the effort, he said. Didn't think it mattered anymore. But what he didn't realize was that his lack of arousal, lack of erections, and even his decreased urinary strength were all connected. His pelvic floor muscles had weakened. Blood flow was reduced. The nerves responsible for sensation had dulled from inactivity. Now, this didn't happen overnight. But it did happen because of one very simple, very preventable thing. He stopped engaging with his own body. And when we began working together, I told Gerald something I tell many of my older male patients. You don't have to climb mountains. You just have to send your body the signal that it's still alive down there. That signal, believe it or not, can come through simple, gentle self-stimulation. Not for release, not for performance, but to keep the blood moving, the nerves alert, and the tissue healthy. Think of it like this. You wouldn't stop walking just because you're getting older, right? You walk to maintain your legs, your balance, your independence. So why stop masturbating when it helps maintain another critical system? Now let's talk about the prostate, because this one is big. Many older men struggle with prostate issues, swelling, inflammation, difficulty urinating, or feeling like they haven't fully emptied their bladder. While some of that is natural aging, a lot of it comes down to one thing: stagnation. The prostate produces fluid, especially during arousal and ejaculation. And if a man isn't regularly ejaculating, that fluid can build up, sit stagnant, and eventually lead to tenderness or inflammation. This can lead to something called prostatitis, or in simpler terms, an unhappy, irritated prostate. Masturbation, even once or twice a week, helps flush that gland. It keeps the fluids moving. It reduces swelling, and it's been shown in some studies to even lower the long-term risk of prostate cancer. So when Gerald began a gentle, intentional routine of reconnecting with his body, he didn't just feel better emotionally. His urinary symptoms improved, his confidence improved, and his regular nighttime bathroom trips cut in half, all from a small act of self-care he'd once written off as pointless. Now let me pause here and ask you something. Has this message resonated with you so far? Have you ever stepped away from your own body, not because you wanted to, but because you didn't think it was okay to stay connected? If this video is opening your eyes a bit, I'd be so grateful if you gave it a like, subscribe to the channel, and tap the bell icon so you don't miss what's next. And please, drop a yes or no in the comments. Have you ever felt unsure about whether masturbation was still necessary at your age? Your answers don't just help me shape future content. They help other men just like you, feel seen and understood. Let's keep going, because there's another layer here that often goes unspoken. Mental health. You may not realize it, but sexual touch, especially when approached mindfully, has profound effects on your emotional well-being. During self-pleasure, your body releases a flood of feel-good chemicals. Dopamine, the reward chemical. Oxytocin, the bonding hormone. Endorphins, your body's natural pain relievers. And serotonin, which boosts mood and relaxation. For older men dealing with isolation, loneliness, anxiety, or poor sleep, this natural chemical cascade can be a lifeline. I had another patient, Albert, 80 years old, widowed for nearly a decade. He told me he hadn't been touched by another person in over 5 years. He wasn't depressed exactly, but he admitted to feeling flat, like he was just going through the motions. I encouraged Albert to explore solo touch again, not with shame or secrecy, but as an act of kindness toward himself. I said, "You deserve pleasure. Even now, especially now." He was hesitant at first, but within weeks, he reported feeling more energetic during the day and more relaxed at night. I even started dreaming again, he told me. And not just about sex, but about being alive. That, my friends, is the power of staying connected. This isn't about lust or fantasy or teenage urges. This is about wholeness. About reclaiming a part of yourself that didn't vanish when your hair turned gray or your schedule slowed down. And I want you to know, it's never too late to come back home to your body. You don't need to perform. You don't need to prove anything. You just need to remember that your touch still matters. Because the moment you do, your body listens. In the next part, I'll share more practical steps for how to reintroduce this practice safely and comfortably, especially if it's been a while. I'll also talk about how masturbation can actually support better sleep, testosterone production, and even self-esteem as we age. But for now, I want you to take this one message with you. Masturbation isn't a habit you outgrow. It's a practice you return to, gently, respectfully, and with the wisdom of a man who knows his body is still worthy of pleasure. By now, I hope you're starting to see the bigger picture. This conversation isn't about one habit, it's about reclaiming something vital. Something that far too many men give up not because they want to, but because no one ever told them. You still have permission. Permission to feel, permission to enjoy, permission to connect with yourself. And if you've been away from that part of yourself for a while, you might be wondering how to even begin again. Maybe it's been months, or even years. Maybe you're dealing with health challenges or mobility issues. Maybe you feel unsure, awkward, or like your body doesn't respond the way it used to. That's okay. That's exactly where we begin. Let's start with a word you might not expect from a urologist: gentleness. You don't need to push, force, or chase anything. In fact, the most powerful benefits of masturbation in older age come from being present, from touching with curiosity instead of performance, with care instead of urgency. Let me tell you about Paul. Paul is 76. He's a widower and a prostate cancer survivor. When I first met him, he hadn't experienced a full erection in over 2 years, and he'd resigned himself to the idea that sex, in any form, was over for him. But he missed the closeness. He missed feeling like a man. And more than anything, he missed being in tune with his own body. We talked through his fears, his health concerns, and his goals. He wasn't looking for fireworks. He just wanted to feel something again. So I guided him through what I often recommend to men like Paul who are starting over: a slow, no-pressure reintroduction to touch. It begins not with stimulation, but with exploration, reconnecting with how your skin feels, where you still have sensation, how your breath changes as you touch different parts of your body. It sounds simple, but for a man who hasn't felt safe or comfortable in his own skin for years, it's incredibly powerful. From there, we added gentle pelvic floor exercises. Nothing intense, just subtle contractions of the same muscles you'd use to stop urinating midstream. These Kegel-like exercises help bring blood flow back to the region and restore tone to the muscles that support erections and ejaculation. And most importantly, we removed the expectation of climax. Because here's something no one talks about. Masturbation doesn't have to end in orgasm to be beneficial. The process itself, arousal, breath, touch, connection, supports everything from cardiovascular health to hormone balance to emotional regulation. In fact, when Paul let go of the pressure to finish, he began to experience something he hadn't in years: pleasure without stress, desire without shame. He told me, "I felt a kind of peace I haven't felt since before my diagnosis." That's what this journey is about. Now, you might be wondering, what if I'm dealing with ED? Or I can't get fully hard anymore? That's okay too. Remember, erections are just one part of your sexual response. Even without them, you can experience touch, warmth, arousal, even climax, depending on your body's current function. What matters is engagement, staying present, keeping those signals flowing. Even just a few minutes of arousal a few times a week can improve blood flow, strengthen your pelvic floor, flush the prostate, boost natural testosterone levels, improve your sleep quality. Yes, sleep, let's talk about that. During orgasm, whether with a partner or solo, your body releases oxytocin and prolactin. These chemicals reduce cortisol, the stress hormone, and prepare your body for deep, restful sleep. In fact, many of my older patients find that even occasional solo intimacy helps them fall asleep faster, stay asleep longer, and wake up feeling more refreshed. Now, compare that to tossing and turning, worrying about your health, or feeling isolated. A few minutes of gentle, mindful self-touch can be the difference between a night of frustration and a night of restoration. And that brings me to one more benefit we haven't talked about yet: self-esteem. When you stay connected to your sexuality, even privately, you carry yourself differently. You walk with more confidence. You speak with more warmth. You begin to remember that you are still a man, with desires, with energy, with the right to feel good in your own skin. I had a patient named Tony. He's 82, sharp as a tack, still walks every morning. But after a long illness and a long stretch of caretaking for his late wife, he told me, "I feel like I lost my spark." So we talked about rebuilding that spark, not with pills, not with performance goals, but with presence. Tony started a simple self-care routine: warm shower, light touch, breathing. He didn't always reach climax. He didn't need to. What he found was something even deeper: he found himself again. He said, "Doc, I thought that part of me was gone. But it wasn't. It was just waiting for me to come back." That's the message I want every man watching to hear. You haven't lost your manhood. It didn't vanish with age, or illness, or grief. It's still there, and with a little attention, a little care, and a little courage, you can access it again. So let me ask you, has this changed the way you think about self-touch after 60? If it has, I'd love to hear from you in the comments. Just drop a simple "yes" if this resonates with you. Or "no" if you're still unsure. That's okay too. Every answer helps me tailor this conversation to what you need most. And if this message feels valuable, please take a second to like the video, subscribe, and hit that bell icon. Your support helps keep this channel going, and helps me reach more men who may be silently struggling. In the final part of this series, I'll share a few more important insights, including how to talk about this with a partner, how solo touch fits into a long-term wellness plan, and how to break the shame cycle if you grew up being told this was wrong. But for now, take this truth with you. You still deserve pleasure, you still deserve connection, and you still have the power to feel alive, right here, right now. Let's bring this home, my friend. If you've been with me through this series, you know this hasn't been a conversation about lust. It's been a conversation about life, about connection, about what happens, physically, emotionally, hormonally, when men over 60 completely shut the door on solo touch. We've talked about blood flow, prostate health, hormone balance, sleep, self-esteem, and most importantly, we've talked about permission. Now, in this final part, I want to explore what happens when you don't go this journey alone. When you begin to bring the conversation to your partner, to your inner circle, or even just to your own heart with kindness instead of shame. Because here's the truth. A lot of men grew up being told that masturbation was wrong, dirty, a sign of weakness or immorality. And those beliefs don't just disappear when you turn 60. They get buried deep, sometimes so deep, you don't even know they're still running the show. I see it all the time. A man will tell me, "I don't really think about that anymore," or, "That's not something I need at this age," but when we dig just a little deeper, what comes up isn't peace, it's discomfort. A quiet voice inside that says, "I shouldn't want this." If that's something you've wrestled with, even silently, let me be the first to tell you, you have nothing to be ashamed of. Your body was designed to respond to pleasure. That design didn't expire at 60, or 70, or 90. If anything, that part of you deserves more kindness now, not less. And if you're in a relationship, here's where it gets even more powerful. When you begin reconnecting with yourself, something beautiful happens. You bring more energy, clarity, and confidence into your partnership. Many of my married or long-term partnered patients ask me, "Is it wrong to masturbate if I have a wife or a partner?" My answer is always the same. Not at all, if it's done with respect, transparency, and self-care. In fact, for many older couples, solo intimacy can enhance partnered intimacy. It helps you stay attuned to your own arousal cycles, your own body's rhythms, and your own needs. And when you know yourself, you can bring more presence, patience, and power into moments with your partner. Let me tell you about Ron and Claire. Ron is 69, Claire is 65, married for 42 years. Their intimacy had faded, not from lack of love, but from health issues, medications, and, as Ron put it, just feeling like our fire burned out. He stopped touching her, and he stopped touching himself. When Ron and I talked, he was nervous to even bring up the idea of solo touch again. "What if she thinks I'm being unfaithful?" he asked. "What if it hurts her feelings?" But when we explored it more, what he was really afraid of was being seen. He didn't want her to know he still wanted. With a little coaching, Ron had a conversation with Claire, open, respectful, and honest. He shared how he missed feeling close, not just with her, but with himself. And to his surprise, she didn't pull away. She leaned in. She said, "I've been missing that part of us too. I just didn't know how to bring it up." That conversation opened the door to something they hadn't shared in years: real connection, real vulnerability, and eventually, physical closeness returned. Not with pressure, but with playfulness. And it started with Ron giving himself permission first. So if you're wondering whether to bring this up with your partner, here's my advice. Don't make it about sex. Make it about connection. Say something like, "I've been thinking about how I relate to my own body. I want to feel more alive again, not just for me, but for us." You might be surprised how many women feel the same way, but haven't known how to say it. And if you're single, widowed, divorced, this journey is just as important. Solo touch can help you stay confident, connected, and emotionally well, even if you're not currently with a partner. It can restore your sense of vitality. And it reminds you that you're still here. You're still worth loving, starting with yourself. Now, before we wrap this up, I want to give you one last message. You are not broken. You are not past it. You are not wrong for wanting touch, closeness, or pleasure. You are a man with a body that still works, even if it needs a little help. You are a man with needs that matter, even if you haven't voiced them in a while. And you are a man with the right to feel good again, not someday, but now. If this video series helped you reconnect with any part of yourself, would you do me a favor? Click the like button, subscribe to the channel, and tap the bell icon. That lets me know you value these conversations, and it helps more men like you find the support they've been silently craving. And one last time, in the comments, let me know. Has this journey changed the way you think about touch, about aging, or about your own manhood? Just type, "Yes," if this message spoke to you, or "No," if you're still figuring it out. Either way, your voice matters here. I read every answer, I learn from every comment, and I use them to guide every future video we make. So thank you for your time, your courage, and your openness. This isn't just a medical topic. This is a human topic, and I'm honored to walk it with you. I'm Dr. Robert Jansen. Stay strong, Stay curious, and never stop growing into the man you're still becoming. Until next time, be well.